Welcome to Open Anesthesia's Sustainability in Healthcare series. Today, we are going to talk about low-flow anesthesia. Anesthetic gases are potent greenhouse gases and can account for up to 50% of perioperative carbon emissions. Therefore, low-flow anesthesia is one of the most impactful sustainability efforts we can incorporate into our practice. First things first, what exactly is low-flow anesthesia? In general, it is when fresh gas flows are significantly less than the patient's minute ventilation, and the patient is rebreathing most exhaled gas and conserving what's in the system. Typically, fresh gas flows are less than 1 liter per minute, but it's not a specific number because it depends on the leak of the system and size of the patient. Notably, pediatric low-flow settings are considerably lower than adult low-flow settings, so it will depend on each clinical scenario. Low flows are best achieved during the maintenance phase of anesthesia. What are the benefits of low-flow anesthesia? The benefits include maintenance of airway humidity and temperature. There is improved occupational safety since exposure of operating room personnel to waste anesthetic gases is minimized. Since utilization of volatile agent is directly proportional to fresh gas flows, lowering fresh gas flows minimizes volatile agent consumption, contains cost, and mitigates environmental impact. Low-flow anesthesia is safe, and it has been endorsed by the Anesthesia Patient Safety Foundation. However, it requires a high level of vigilance. As fresh gas flows are reduced and rebreathing increases, the concentrations delivered in the circuit and concentrations inspired by the patient can be quite different. Therefore, attention to anesthetic gas concentrations, oxygen concentrations, careful monitoring and adjustment of gas flows to maintain an appropriate balance of oxygen and anesthetic gas is critical. There are concerns about low-flow anesthesia and volatile agents reacting with traditional carbon dioxide absorbents to produce compound A and carbon monoxide. Newer absorbents are on the market that produce very little compound A or none at all, and the safety of low-flow sevoflurane has recently been endorsed by the American Society of Anesthesiologists. Please refer to the ASA statement and our low-flow sevoflurane video for more information. There are also reports of carbon monoxide production with traditional absorbents containing large amounts of strong bases. Newer absorbents contain very little strong bases or eliminate them entirely. Furthermore, carbon monoxide production is highest when using desflurane with a desiccated absorbent. Therefore, utilizing low fresh gas flows to prevent desiccation remains a major strategy in mitigating carbon monoxide formation. Let's go over how to calculate a safe minimum fresh gas flow. First, calculate the patient's oxygen consumption, which is 5 milliliters per kilo per minute. So for example, a 70-kilo adult would be about 350 milliliters per minute. Since the gas analyzer is constantly aspirating from the system, this loss needs to be accounted for and is about 200 milliliters per minute. But some machines return this lost gas back to the circuit. Check your machine's manual. The leak of the circuit and patient airway should also be accounted for. Finally, the minimum safe fresh gas flows equals oxygen consumption plus gas lost from sampling plus leak. Alternatively, utilize the low-flow wizard or EcoFlow on your machine. For example, Draeger's low-flow wizard suggests the minimum flow based on the leak and uptake by the patient and the carbon dioxide converted in the absorber. It indirectly measures the volume in the circuit by assessing the pressure changes in the reservoir bag during exhalation. Here are some low-flow tips. The most efficient technique is a closed circuit, but this is almost impossible to achieve, as there will always be some loss in any circle breathing system. During induction, high flows are oftentimes needed during induction, but note that fresh gas flows higher than minute ventilation waste volatile agent, and the speed of induction is not accelerated. Therefore, during induction, overpressurization or setting the vaporizer concentration higher than intended while still keeping flows low can achieve rapid changes in volatile agent concentration. During intubation, try turning off flows instead of the vaporizer to mitigate the washout of gas that is already in the system. With this technique, none of the gases are washed into the operating room, thus minimizing occupational exposures and allowing the initiation of low flows upon reconnecting the circuit. Don't forget to turn flows back up. Maintenance. This is the best time to utilize a low-flow technique, as this is typically the longest period of time of an anesthetic. During emergence, turn off volatile agent early, but keep fresh gas flows at the lowest possible flows. This can maintain and preserve end-tidal agent concentrations without ongoing utilization of anesthetic gas from the vaporizer. Of course, all of these techniques require vigilance, practice, and attention to detail. A low-flow technique is common practice in pediatric anesthesia as well. It is particularly relevant during inhalation induction since fresh gas flows in excess of minute ventilation contributes unnecessarily to waste and does not accelerate induction. Calculation of the patient's oxygen consumption based on weight is important during the maintenance phase. Please see the Society for Pediatric Anesthesia's one-page summary for reference. The ASA and the APSF offer an online course on low-flow anesthesia techniques. This course uses simulation-based learning to cover key strategies for managing fresh gas flow during anesthesia. Each topic lasts about 15 minutes and is self-paced. It's free through the ASA Education Center, and you can earn continuing education credits. Do you utilize low-flow techniques at your institution? Why or why not? Stay tuned for more open anesthesia sustainability videos and a future one on closed-circuit ventilators. Thank you for watching this sustainability video. It was produced by Dr. Jacklyn and Dr. Carole. Here are some references.